So let me just start off by saying Mediterranean diet is usually characterized by a plant-based diet, lots of fruits and vegetables, legumes, seeds, maybe meat protein in the form of chicken, poultry, fish, trying to avoid red meats, trying to avoid processed foods, trying to avoid processed sugars, trying to minimize dairy. So what I'm saying, it's more certain parameters, right? Whereas Chinese medicine is more individualized. What I mean is not every arthritis patient is given the same thing. What I mean by, I said this in our last webinar, it's not the disease, it's the patient with the disease. So you can have two patients with rheumatoid arthritis and you can give different recommendations because it depends on the person. So what I mean by that is you can't study something like that. You can't study Chinese medicine in terms of how it's used real world and compare it with the diet like Mediterranean diet, because the Mediterranean diet is very much more standard in terms of you can study that because it's pretty consistent in what's being recommended. The Chinese medicine, on the other hand, Chinese nutrition it's not consistent enough where you can actually study it because the studies are trying to eliminate all the variables and trying to have something very fixed. But so that's one thing. But in terms of recommendations, the Mediterranean diet is actually very healthy. It's been shown in studies to help with heart disease, with cancer, with decreasing mortality. And I think it's also been shown in studies to decrease inflammation. So I think it's a great diet when it comes to arthritis, for example. So I would be for that. But I would say that there would probably be some fine tuning. Mediterranean diet maybe as a foundation, and then fine tune it with some Chinese nutritional recommendations depending on the person with the arthritis.